Hello people, in this video let us look at this pathology textbook, Robbins and Cotran, Pathologic Basis of Disease. So basically this is the textbook for MBBS pathology and written by Manoj Singh Vinay Kumar. This is volume 1 and this is volume 2. People read this book or they read Harsh Mohan. So let us look at this volume 1 now. So pathology is very interesting according to me because it tells you exactly what is going wrong, So if you can fix that, and also when it goes wrong, what else is affected. So that is what is pathology. So we are looking at volume 1 now. So that they call it as the pathogenesis, right? So there is something called as a gross appearance and a microscopic appearance. So both are there in pathology. So they're telling you the key concepts here in a tabular format. So this is volume 1. Let us see the contents. So volume 1 has genetic, neoplasia, all that will come from your, initial part of pathology. So then you have the blood vessels, heart, etc., red blood cells, bleeding disorders. And then comes volume 2. In volume 2 looks like you have the respiratory, the GIT, liver, so then specific things, breast, skin, bones, joint, etc. Okay. So at the end of every chapter, guys, they have given you the key concepts. Like for amyloidosis, it is a disorder characterized by the extracellular deposits of misfolded proteins. So remember, this is not just protein deposit, it is misfolded proteins. Okay. So that will form insoluble fibrins. So what will happen because of amyloidosis? All that they're telling you here. So looks like this is the chapter name was what? Amyloidosis, right? The chapter name was amyloidosis. So the entire chapter they gave in a small summary, which I think I like. At least this much you can read quickly. And then they have given references for that chapter. This book is quite famous, though I have personally read Harsh Mohan. The diagrams in this book are very nice. That's what I feel like. They look very professional. Now let's take a peek into volume 2. Like I told you, volume 2 is all about the respiratory, abdomen, etc. So you have the lung, the GI tract, the liver, gallbladder, pancreas, kidney, in the urinary system, genitals, breast, endocrine, skin, bones, joint, peripheral nerves. So this is like specific pathologies. Okay, and then you also have the central nervous system and the eye. Eye is given special. Let's look at that also. So what do you see here? This looks like an alveoli to me. This looks like the capillary injured alveolus. So basically here you can see that type 1 cell, type 2 cell. Okay. And here what is happening? In the injured one, there are cytokines. Okay. Chemokines. So those cytokines, that's what they're telling, right? What exactly is this purple one have? Okay, it's a neutrophil. Okay. So that is producing your cytokines and proteases and ROS, is it? What is ROS? See, they have mentioned here reactive oxygen species. So this is what is happening in an injured alveolus in the early phase of acute lung injury, acute respiratory distress syndrome. So basically here they're telling you the clinical features and there is no proven treatment they're saying. So it's nice that they're talking about treatment also, but here they have not told you the treatment exactly, right? So intubation, high ventilatory pressure. So basically you have to give oxygen, right? So key concepts about this acute respiratory distress syndrome also they are discussing here. See, in the exam, you have to draw these type of pathology, microscopic pathology diagrams, okay, which I don't see in this book. But in Harshmohan, I have seen the hand-drawn also, because you need the hand-drawn to know how to draw it, correct? So that is something which is not there in this book. So let's look at that one more diagram here. What is this? Pancreas, isn't it? This is the glomerular disease chapter. Okay, glomerular diseases. So that's the kidney there. So they are talking about the loss of this middle one. What is this? What exactly are these purple things? Adhesion molecule, epithelial foot processes. Oh, those podocytes, that's what they call them, right? So epithelial cell injury. Okay. This is the best way to understand any disease. I love pathology because pathogenesis is what tells you exactly what is going wrong, why it is going wrong, what you should treat, because a disease and its symptoms, anybody will tell you, but why those symptoms arose? If you understand that story, pathology is very nice. I like it. So this is a lot of diagrams here. This page looks awesome. So basically in your dreams, you'll get only this pink and purple. All your dreams for a pathologist, I think, will be this pink and purple. Eosinophil and hematoxylin, right? What am I saying? What is that? I think it's eosin and hematoxylin stain, right? So a lot of diagrams here. I think this book is reliable. Harshmohan has mistakes, so I think this is reliable. However, this book does not seem to have the hand-drawn microscopic images. And another thing is your practical pathology, right? That also is not there in this, looks like. At least Harshmohan gives a separate pathology or practical notes, which is not there in this. This is the latest edition, looks like. So in this video, we have looked at both volume and volume 2 of Robbins and Cotran Pathologic Basis of Disease, South Asian edition, South Asian content. It has some restricted sales also, looks like. Hope you have learned something in this video, people. Bye-bye.